Yay, you're welcome. So it is 3 months since I've had my son. My goodness, the time flies. Now would be a good time to share my birth story with him. Now, it was a positive birth story initially. If you're currently pregnant and you don't want to hear about all the bad things that can happen, I would recommend not watching this video. It was a very good birth, but the after story was not so great. So to begin with, I felt like I was in labor for about 3 weeks, and I think I said that in my vlogs that it just like, I just feel like I'm in labor all the time. When it actually came to the time for me to actually be in labor, I prayed to God. I was like, please make it super, super, super clear that I am in labor. Otherwise, I'm not going to go to the hospital. I'm going to end up having this baby at home or in the car. Just like, God, please make it super, super clear that I need to go to the hospital, that I'm in labor. Please just make it really clear. And about 11 o'clock, my waters broke. That was very, very clear. Thank you, God. At first, I was like, oh, did I just pee myself? Like, it wasn't very much. I'm like, oh dear, like, do I wake Ralph up? Do I make a fuss? God obviously knew that I would think those things and then sent me a massive water break. Like, my water just kept breaking. It broke like 3 or 4 times. That was very obvious. That was very good, very clear. But instead of rushing for some reason, I think I cleaned the toilet. I walked around the house for a bit and I'm just like, oh yeah. Just like cleaning up the kitchen, putting things in bags for charity. I was just doing all these things at 11 o'clock at night. You think that I would be rushing and stressed and like worried that I was gonna have this baby super quick. Like, I'd want to be in the car, right? On the way to the hospital, right? No, I was too busy nesting and cleaning. Being my 4th baby, you'd think that the baby would come pretty quick, so you'd need to like get to the hospital super quick, but no. Just take our time, get all the kids in the car, make sure Daisy's out of the bathroom. We lock her up at night, so we made sure that she was out, which is a good thing because little did we know we were not going to be coming home again for 7 days, and I'll get to that in a minute. We're doing all these things. We end up leaving like an hour later, which, you know, I had contractions, but they weren't super heavy. In fact, I remember thinking, why am I not having contractions? Like, why are they not painful? But my water broke, so I was like, am I in labor? I don't know. I think God was just giving us a chance to be able to drive down and drop the kids off to the great-grandparents, because if we couldn't do that, we were going to be taking 3 children into the hospital and they were going to watch me give birth. And that's not ideal. So it was really relaxing. It was really nice. I listened to my playlist that I made on Spotify, and it just, the words just kept me really calm. I couldn't sit down in the car. Like, well, really, I couldn't sit down for the last 3 weeks of my pregnancy anyway. There was no way I was going to be sitting with a safety belt on in the car. So I was like hushed backwards, like squatting in the car like this. And I'm just talking to the children, trying to keep them calm, and we were just saying, oh, the baby's coming. And then the contractions started to be painful. And I remember the kids would ask me questions and I couldn't answer them, and they're like, okay, you're being a bit weird. I was in the car talking to the kids, listening to music, not able to sit down, just joking, laughing. Must have been pretty tired, I don't know. The kids were excited, and so we dropped them off, just okay, bye. And then I got to the hospital, and that's when things started to ramp up, which is a good thing. I think mentally I wasn't ready to have the baby, so it was just like, oh, okay, let's just plod along and, you know, relax and do things that we're not meant to be doing. And they're fully aware of my condition by this point. I'd been seeing the same doctor. He had it in my file that I would need to have hydrocortisone during the 2nd phase of labor. And the problem is that we didn't know when that would be. We didn't know when I was going to enter the 2nd phase of labor. We didn't know whether my labor was going to be really, really long. We didn't know whether it was going to be short. Based on the last couple of labors, Zaya was 18 hours, Alyssa was 2 hours, more like 40 minutes, barely got to the hospital and she came out. Nahara was 4 hours, that was me with just walking around the hospital. And then Auden came in 3 hours, which was really nice. It wasn't too fast, it wasn't too slow. It was just perfect, to be honest. It was just the perfect amount of time. I was relaxed. I didn't feel like I needed an epidural. I didn't feel like I needed pain medication. I didn't even feel like I needed cortisol at this point. I was just like, yeah, I don't think I should take it yet. I don't really need it. Like, I'm not ready yet. And then like 10 minutes later, the contractions really ramped up and Ralph was doing the counter pressure on my back, which is amazing, by the way. Like if he didn't do those counter pressures, I started to feel like panicky, like I couldn't cope with the contraction. But every time he would come in, he would do the counter pressure on my back, like squish, I don't know exactly where, but you know, the side, I guess sciatica, and he would squeeze it like really, really hard, and I would just focus on opening up to be very descriptive there. I didn't focus on clenching, I focused on completely releasing, completely opening up, just like, you know, like a little flower. Sure you wanted to visualize that. Anyway, each contraction I did that. They weren't letting me walk around, they weren't letting me move, which is why I think the labor was a little bit slower this time, because I really felt like he would come quicker like with those kind of contractions. But because they wouldn't let me walk around because of my condition, they were waiting to give me the hydrocortisone. I was attached to a drip and everything, ready for the medication to go in, and so they wouldn't let me move around like I did in all my other labors. Like I was able to move around, I was able to walk, I was able to squat, I was able to shower, I was able to have a bath. They wouldn't let me move around, and I really feel like that slowed it down, but that might have been a good thing. That might have helped my body just to be ready, but not too long that it stressed my body out. The doctor was actually saying quick labors are better for these kinds of conditions like adrenal insufficiency, because it actually causes less stress on the body to have the baby quicker, even though you would think that would be more stress. Yeah, I'm on the bed, I'm lying on my side with my legs open, my husband's counter pressuring on the back, and they're trying to figure out when to give me this medication. The midwife is a little bit like, I don't want to miss it, I don't want to, you know, I don't want bad things to happen. And I could tell she was apprehensive. She'd never had someone like me before, I guess. And I was just like, I don't think I need it yet. No, I don't need it yet. And then, like I said, 10 minutes later, I was like, oh, and I started to feel dizzy. I started to feel sick. I started to feel like all of the adrenal insufficiency symptoms, like I was going to pass out, like my body was shutting down, my arms didn't want to work, my legs didn't want to work, like I couldn't stand, I was going pale. And they had given it to me like after that, when I started to feel the symptoms. I was like, yeah, I need it now. I believe it was 100 through the drip, and pretty much maybe 10 minutes after that I started to feel great again, felt lots of energy again. I didn't feel like it was, oh, when is this gonna end? Like I felt like I could keep going. And at that point the midwives were like, oh, you can get up now, you can go have a bath, you can, you know, move around. And I was like, I want a bath now. And it had always been a dream of mine to have my babies in water. Like for some reason, I don't know, that just sounds really peaceful and lovely and calm, and I love showers, I love water, it's just relaxing. It's just like water therapy. So I was like, yeah, I want to have a bath. I secretly knew he was going to come pretty soon, but I didn't want to tell them that, because then they'd be like, oh, don't get in the bath then, because at the hospital that I go to, they don't do water birth. So I hop in the bath and I'm just like as relaxed as you can be with pretty painful contractions, trying to relax, not clench any part of my body, just, you know. And the postpartum and pregnancy TV on YouTube really helped me with breathing this time. Like I'd never thought of it that way, as making kind of noises because it actually helps to push without you realizing when you make those lower tones. And when you make the higher tones, like the screaming and the panicking, it actually doesn't help pushing, and it just doesn't help labor in any way. It doesn't help with pain management. Whereas doing the low tones actually helps you to push and bear down. That was interesting, and that really helped me during this labor, which I hadn't realized before. I knew it was never a good idea to be screaming and to be panicking, because then you lose all control and then everything's more painful. Whereas this time I just understood why. And so, okay, I was in the bath, and at this point I had 2 midwives. I don't know if that's normal, probably. And they're telling me, all right, so just you enjoy yourself. And they just left me with Ralph, and he's still doing the counter pressure. Poor guy is like awkwardly trying to get into the bath to do the counter pressure on my back. But I was not letting him have a break. Nah, that was like, nah, you right now. Contraction. Yeah, I really started to feel panicky, which is really bizarre. I don't think I felt panicky the last 2 births, but this birth I really felt panicky if he wasn't there. Like I really relied on him so much more, whereas all the other births I was just like, leave me alone, just leave me alone. Oh, baby's awake, I'll get him in a minute. Things really started to progress. I could hear myself like starting to, you know, that really transition time. I could hear that there was happening. The midwives could hear, and they came in and they're like, all right, this is time. They're telling me to move and like, can you get out of the bath and all that. I'm like, no, I'm staying in this bath. Like, no, I can't move. And so I'm still squatting in this awkward position, and this poor midwife is trying to get under there to like see what's happening. And in 3 pushes, he was out. You could feel everything. Like, he was not hard to push out, which is strange because, I mean, Alyssa was not hard to push out. She had a smaller head, I guess. And Auden also has a smaller head. I don't know if that's something to do with it, but it was very easy to push out. And it kind of feels like you're being torn apart. It was different to the other labors because in my mind, I constantly could say, right, this is incredibly painful, but you know that you're gonna make it through this. You know that it's almost over. It's almost over. It's almost over. And I was able to stay with myself this time, whereas in all the other labors, I kind of lost myself and like disappeared into not my happy place, just an abyss of nothingness. Just didn't want to exist, didn't want to be there, I guess it's like a protective mechanism for your brain to just like disappear. But this time I was fully present for his birth, and it was very nice. It was very different, and I was just like able to self-talk to myself. You're gonna make it through this. It's almost over. You know that it's almost over. You've done this before. You know that this is the worst part, but it's almost over. You know it's almost over. I just kept saying that to myself, and it really helped. Anyway, got through the birth. Everything went smoothly. I didn't even need to have any more medication after that. They got me to get out of the bath then to deliver the placenta on the bed, just because it's a lot easier. Looked down in the bath, big mess. Like, I don't think I've ever seen the mess before. I've never looked. I think this is the first time I gave birth in a bath. I didn't have the water in there, by the way. I had the water initially, and then when the baby's coming, the midwife like took the water out. I don't know. I just wanted to have a water birth. But whatever. I was in there long enough. I had no tearing, nothing like that. Didn't need stitches. The placenta delivered, and there was nothing wrong with the placenta this time, which the previous birth that I had with Nahara, the placenta was half dead. There was nothing wrong with this placenta. Everything looked good. Baby looked good. Baby was an excellent size, the biggest baby I've ever had. He was 3.5 something, 3.52, something like that, kilograms. So he was a very good size, whereas Nahara was previously I think it was 2.5, or even smaller, I don't know. She was on the cusp of having to go to the SpecialCareNursery because she was so little. Anyway, he was a big boy, but he wasn't hard to deliver, So delivered him in the bath, massive mess, never seen it before in my life. Of course I pooed everywhere, and like I was just apologizing to the midwives. I'm like, I'm so sorry, because I had always imagined that if you pooed yourself when you're in labor, that it would be like a nice formed poop. No, it's full on diarrhea. I'm sure you wanted to know that. But yeah, just being real here, in case you haven't given birth before and you expect something beautiful. Mess everywhere, and I'm just like, I'm so sorry. And they're just like, don't worry, you did it in the bath, it's so easy to clean up. I'm like, whatever, you're just lying to me. Anywho, went to the bed to deliver the placenta. Everything went smoothly. Had my injection so I didn't bleed out. Having the injection guarantees that I'm not going to bleed out. It makes my milk slow to come in though. It delays my milk by like 5 days, which is not great, but it's better than dying. So I knew that my milk was going to take a long time to come in, because it always takes a long time to come in. It's 5 days of pretty much colostrum or nothing. So I knew that it would take a long time. I was ready to deal with that. What I wasn't ready to deal with was what happened the next 7 days. And it was very traumatizing, and it's enough to make me go, right, there is no chance that I am ever going to have another baby. This is too much. It's just, this is the end. So I got into our room. Obviously I was in pain. I was wearing tights, which I shouldn't have. Ladies, just go like with the nappy pull-ups and don't wear anything else on the bottom, because you're gonna leak through and it's just gonna cause more laundry. Just for the first 3 days, wear a dressing gown. Don't wear anything down below except for the pull-up nappies, because you're just gonna leak through and it's just frustrating. I was like, all right, I'll wear some tights, I'll be cute and be able to walk around. And just don't. So I'm in my bed, Ralph's there, baby's there, and I'm looking at him and it's like, he doesn't look right. He doesn't look the right color, but I'm just like, okay, maybe he's just, you know, newborn color. They look a little bit funny. He looked a little bit red and a little bit purple in the face, and I'll show you a picture. And he just, yeah, he didn't look right, and he looked puffy. And I noticed like his breathing was really like his whole body would move when he's breathing. I'm like, that's not right. Like, I had 3 other babies. They never did that. That's not right. He wasn't feeding. He would not feed. Whereas all my other babies were attached to me for like 24 hours. They would just feed, 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 feed. He would not feed, and I think it was because he couldn't breathe. At first I thought, okay, maybe it's just because he's a good weight, because all my other babies were really small. Maybe they were just extra hungry to try and get their weight up, but he would not feed at all. I think he had 1 good feed after birth, and that was it, for hours and hours. And it ended up being about 5 hours later. I was like, Ralph, can you please ask a midwife to come and check his breathing? I don't think it's normal. And the midwife comes in and goes, oh yeah, it's normal for them to be snuffly. And I'm like, I don't. So Ralph, like, can you just check a little bit, like, can you check a little bit more? And she took off his clothes, and his lungs, you could see, were concaving, which they're not meant to do. They're not meant to suck in. So they were sucking in under his ribs and like that. And then she's like, no, that's not normal. And then she's showing me how, like, because it's sucking in, that's not normal breathing. Then we ended up having to move him to the special care nursery. As you can see, it's a bit traumatic. At least it's been 3 months, so I can actually talk about it without crying now. And the midwives, all of them were lovely except for one, and I'll get into that later. But it's very rigid in the special care nursery. They have to follow very strict rules. And he was put in the incubator, and he had like a breathing tube, and his oxygen was always good except for once, which is very surprising. Like, they were all surprised, like, why is his oxygen so good? So that's a blessing, I guess. Just a nappy on him, and we were able to like touch him through the incubator. And I really feel sorry for parents who have to stay there longer. Like, we were only in there for a week, and that was long enough for me. That felt like a lifetime. I can't imagine other people who have to keep their babies in there for months and months and months. And my heart really goes out to you. I only understand a fraction of that. So he's in the incubator. They don't know why. They don't know what's wrong with him. They start doing all these tests. Poor little baby's just getting pricked every couple of hours. He's just like bleeding and pricked, and needles, and he has a little catheter in his hand. And he's just, they don't know what's wrong with him. They test him for things, and just everything comes back normal. And they finally get to the conclusion that it's probably an infection, that he was born sick, like born with a virus or an infection, and then they're not sure what it is. So they end up giving him antibiotics, like 3 different antibiotics, and he starts to get better, except for one day when there's this specific nurse who gave him full-on formula without my permission. Not that I'm against formula, but I was really trying to establish breastfeeding at this point, and I was trying to give him every opportunity to get rid of this virus, to get rid of whatever this was in his body. And I was driving myself mad pumping. I was pumping every hour, through the night, through the day, just no break. I wasn't able to feed him for several days, for about 5 days I think, and I'm trying to pump, I'm trying to use their pump, trying to hand express, and it's just, everything's painful. And lucky I had my own pump at home that I got Ralph to bring in, and that I was able to pump. But the nurses were constantly like, oh, just sleep through and we'll just give him formula. And like, I knew that was going to be detrimental to my supply coming in, and I was already late coming in with my milk supply. So this one nurse, she gave him full-on formula, not mixed or anything, didn't call me, didn't ask me to come, and he went downhill then. Like, there's something, a connection between him feeding and him going downhill with his breathing. So every time he's feeding, I think because it was such an effort on his body to like digest and do all these things, it made his breathing so much worse. And the formula was like 100 times worse than having breast milk. It was just, it made his breathing so bad that we had to like stop the feeding again and go back to an IV drip, just giving him sugar. So that really made his health go backwards by like probably 2 days. And this same nurse, we wrote a complaining letter about her, and the main midwife took her off. Like, we weren't allowed to see her anymore. Anyway, she was telling me, like, Auden was crying in the incubator and he had done a poo and I could see that his nappy was dirty. So I was like interacting with him and talking to him and like trying to change his nappy. And she comes over and says, oh, you need to leave him alone. You need to stop touching him, leave him alone. Yeah, they need to rest. I'm like, don't tell me not to touch my baby. I'm gonna touch my baby. He is crying, he's upset, he's not resting. He has a dirty nappy, I'm gonna change his nappy. You don't tell me not to touch my baby. I went full mama bear. I was just like, Ralph had to hold me back. I was just like, you don't mess with a woman who's just given birth. Like, honestly. You don't tell a woman who's just given birth to her baby not to touch her baby. Like, that is just like, that was just one thing that she did, but, and the formula as well. So, I'm not going to go into all the other things, all the other issues that we had with her. Suffice it to say, we didn't see her again because it wouldn't have been pretty. We're in the special care nursery. I'm pumping every hour. I am absolutely exhausted. I am bleeding like so much. It's just, I'm in a room by myself. And then one of the tests that they wanted to do was a lumbar puncture on Auden's spine, and he stopped breathing. I said to the doctor, I can't be in the room when you do this test because of my adrenal insufficiency. It'll be too much stress on my body. I will just pass out and then you won't be able to focus on the baby. You'll have to deal with me. So I can't be in the room. So I wasn't in the room for the test. But then she came to my room afterwards and she told me that he had stopped breathing, that they couldn't finish the test. They couldn't finish the lumbar puncture because he stopped breathing. And I just lost it. Like, I was okay for a few minutes. I was crying. I'm like, it's my fault, and blah. And she's like, it's not your fault. And I took extra medication, but obviously it wasn't enough. And we went to the room to see him, and he looked like purpley and just like his breathing was not good, but he was breathing at least. And so they went to do some other tests on him. They kept doing more tests after that. They probably should have just let him rest. But he was on the table under the light and I was sitting on a chair just close by. And the doctors were just like, he just kept crying. Like, he just kept crying, and I thought maybe they're hurting him, but that's just him. He just cries all the time. He's just a difficult baby. Anyway, it kept playing in my mind that he almost died and like, we're not going to get out of here. And I just felt like he was never going to get better. Like, this was it. He was just going to die. And I started to not feel very well. And I said to Ralph, like, I don't feel well. I'm going to pass out. I don't feel well. Ralph's like with Auden, with the baby. And he's just like, she needs help. Lucky with I don't know if it's the same way for all adrenal people, adrenal insufficiency sufferers, but like, I pass out slowly. So it's like okay, I'm gonna pass out, and I pass out slowly. So it's slow enough that I can get to the floor without, you know, just like, it's just like, ooh, like I know I'm passing out. And so it's very slow. My head goes floppy, my arms go floppy, my legs go, and then I've just passed out. They went into like all this fussy mode, and I'm just like, I'm to the point where I pass out so often that it's just like, I'm not even scared anymore when I've passed out. Like, I'm fully aware in my brain. And I'm just like talking to myself in my brain. I'm just like, oh, here we go again. Sorry, don't worry about me. Just leave me here. I'll be right in a minute. You know, like, just put me on the floor. I'll be right. But of course I can't say this and I can't verbalize this. And I'm just like, yeah, I'm just like so annoyed at myself, you know, like, oh, here we go again, drama queen. Anyway, they get me a hospital bed. They pump me full of hydrocortisone, like they put the vein in, where is it? They put it here in my arm, so I couldn't bend my arm for like 3 days. It was so annoying. You think they could have put it somewhere else more convenient, but I guess they were just, you know, trying to keep me alive. They get that in. There's this one doctor that's just like, and all the other ones are like panicking. They don't know what to do with me. And they wrote down on my card later that I was having seizures. I don't have seizures. Like, after I have my episode, I do like do this, like a jolt, but I'm not having a seizure. Anyway, they don't understand. So they end up moving me to, what's it called? Is it intensive care? I don't know. And I completely mentally lose it. I'm like, I don't know where like, they wheeled me down on the bed and I had my eyes kind of closed. So I didn't even know that I'd really moved room. It's dark and it's like a cave and there's no windows, there's no light. I feel like I can't breathe. They wheel me into this big, like this room with just a curtain with weird people all around me. Like, I don't know where I am. Where am I? Like, I mentally lost it. I was not who Like I was not normal, and Ralph had to like hold me, and like I was just like looking around panicking. That's all I can describe it as. It's just sheer panic. And I was like, I don't want to be here. I don't want to be here. Take me back to my room. I do not want to be here. I don't know where I am. I do not want to be here. And I'm talking to the nurse. I'm like, I don't want to be here. I was probably the most difficult patient she'd had that day. I was like a mental patient. Like you could not reason with me. And she's like, all right, just stay here for an hour. Put you in the bed, just rest. I'm like, I don't want to be here. I don't want to be here. I don't have my own bathroom. And that was a big thing as well. Like I was bleeding a lot. I was wearing the nappies and I didn't have my own bathroom, and I could barely walk. So it's like, where do I go to the bathroom? I don't want everyone to see me take my stuff to the bathroom. Not that it matters. Anyway, they made me stay there for a whole night, and they were going to make me stay another night. I'm like, no. But during that night, Ralph was able to stay with me, which is the one good thing, because previously I'd just been in the room by myself without a baby. Like I had given birth to a baby, but I didn't have my baby. It was just weird. So I was in the ICU, and Ralph was able to sleep on one of those pull-out lounges things, and he was able to keep me a little bit sane, because I would have absolutely lost my mind. Not okay mentally. I didn't even remember what really had happened. I didn't know where I was. And they kept trying to give me hydrocortisone every hour after that episode. They tried to keep giving me 100, I think it's 100 mg of hydrocortisone every hour. And you don't do that. You only do it for initial stress dose. And if you keep, you know, going into a crisis. I was not going into a crisis, and they kept trying to give it to me in the IV, and I'm like, no, I'm not having another 100. It'll make me psycho. Like I already couldn't sleep from the medication, and they wanted to give me more so I wouldn't sleep. That would be so great for my mental health. Anyway, she comes in and she's like, oh, I'm gonna give you another 100. Like, no, you're not. You are not giving me another 100. I'm not having another 100. That will not be good for me. That's not what you do. And she's like, all right. And she goes to talk to someone, and she comes in again. You need to have this medication. I'm like, no, I'm not having the medication. I know what I need, and I'm not having another 100. Anyway, she had to write on the report, patient refused medication. Damn straight I did. I don't need it. They do not understand how to take care of someone with adrenal insufficiency. I'm like, I can manage my condition from here, thank you. If I have another episode, sure, but I'm not having an episode right now. And they came in again like an hour after that. I'm like, no, I am not having another 100. Can you imagine? By the time I wake up in the morning, I would have had like, I don't know, like way too much medication. Anyway, spent the night in the ICU. Took forever to discharge me. I was like pacing around the room. I was like, I don't want to be here. I'm going to walk out. I'm going to like escape. You cannot keep me here. I felt like a mental patient, to be honest. Like I felt like they should have strapped me down or something, because that would have been fitting. Anyway, I'm like, I'm going to go have a shower. I hadn't had a shower, a proper shower, since I gave birth. Like, the midwife only let me have a body shower, just wash off. No washing my hair or anything. I'm like, I need to have a shower. It's been like 4 days, and I gave birth 4 days ago, and I am disgusting. I need to have a shower. And they're like, oh, you shouldn't have a shower because it's gonna make you pass out. I'm like, no, I need to have a shower. I'm gonna have a shower. And she's like, okay, make it a quick one. I have a quick shower, which wasn't actually quick. I ended up being in there for half an hour. And I'm like, you can't make me not have a shower. Like, you're gonna come in and watch me naked. That's fine. I'm gonna finish my shower. Anyway, I left the door open so Ralph could be there in case I needed help. And apparently showers do make you pass out because they open up your blood vessels, which I didn't realize. And that's why after having a shower, I always feel so like fainty. I was determined to wash my hair, and I wasn't just gonna sit around waiting for them to discharge me. It takes forever. So finally they discharge me, and I end up going back upstairs to a new room. This room meant that I didn't need to share with anyone, because the first room that I was in, I was sharing with this lady who was watching Indian soap opera, and it was so ridiculously loud. It was just this Indian soap opera for hours and hours and hours, and it was just ridiculous, and I couldn't rest. Once my baby had been taken from me and I was trying to sleep, she would just play this Indian soap opera for hours, and I'm just like, I just wanted to like smash her phone or something. Anyway, they moved me to a new room where I was by myself, which was good and bad, you know. I was able to just be by myself and just process my emotions and pump by myself. But it was very, very lonely. And I just tried to distract myself. Yeah, read a lot of Bible and listened to a lot of music, my playlist that I made for birth. And it was just, yeah, it was just a really, really tough time of pumping every hour and trying to stay sane and, you know, not going outside for all that time as well. It just takes a toll on your mental health. And I I got to the point where I didn't even want to see Auden by myself because I would just fall apart crying, and I couldn't do that without Ralph being there for me, because when I get upset, I don't know whether I need more medication or not. I'm not even allowed to get upset really. So I just didn't see him. I didn't go and see him unless Ralph was there, and it was really hard to process what I'd been through, that I had a baby but he wasn't with me. He wasn't in the room with me. Like, where is my baby? And it was just, it's not natural for you after you've given birth to not have your baby with you. I believe that takes a toll. It doesn't feel right. It doesn't, I can't describe it. You know what I mean. I'm going through all this horrific recovery, but I have nothing to show for it. No one could visit him. My parents couldn't see him because he couldn't leave the special care nursery. He couldn't leave. He was in the incubator for 6 days, which just felt like a lifetime, to be honest. He just looked so helpless. He finally responded to antibiotics. They did a shot of his lungs, and initially it showed that they had like fuzzy stuff on the lungs, but that had gone. So I think he was just born sick, because I had had COVID when I was pregnant. I had had bronchitis, I think it was, while I was pregnant. And I had taken antibiotics when I was pregnant, 2 different types. So I feel like I made him sick. So hard not to blame yourself. Finally, I think on the 6th day, they took him out of the incubator, like, he doesn't need to be in here anymore. He's doing great. He's feeding well. I was able to breastfeed him at this point, and they were doing some top up. And finally, the day before we leave, he gets to stay in my room, and it felt right then. It felt like my hormones had settled down, and I felt so much better, and he was doing so much better as well. And then after that, we got to go home. The kids finally got to see him in the hospital when he was in my room. He came to visit me after school, and at this point Ralph had picked them up from school. This was the first day that we actually got to bring the kids home, because they'd been moved around from family to family, because we didn't expect to be in the hospital for that long, for a week. They only had 1 set of clothes, 1 set of pajamas, everything. So they just, poor kids, but they coped really well. Like, I'm really proud of them, how well they cope, how resilient they are, because if they weren't able to cope and they weren't that resilient, I think it would have been a lot harder. But they just came into the hospital and meet their new little brother. They were just all so sweet and excited, and they just love him. He's a very difficult baby, I must say. Like, he's very demanding, like cries a lot, but they just love him unconditionally. Whether he's screaming in their face, they just love him. It's really nice to see their unconditional love, and it's a reminder as well that I love all of them unconditionally. So yes, so that was my journey. My birth story in the hospital and my first week postpartum, and it's all a blur now. Like, his lungs definitely work now. Yep, I might go get him so I can show you. You had a big sleep, didn't you? Did you have a big sleep? Oh dear, gotta change your nappy. Hi, thank you so much for joining us.
When you feel it's hopeless, when you think that you lost, oh, I will take your hand and we'll rise up from the dust.